most recently, myself and a group of 3 other researchers out of Cedars-Sinai, this is the team that I worked with, we sought to kind of investigate, what research has been done out there about the medical uses of vibrators, and do we have a way, like a reason to be, needing them as a medical tool, or should we be prescribing them? And so what we found was the most overwhelming evidence is that vibrators can without a doubt, treat dysfunction, especially in people with a vulva. There is a study from, I believe, Struck et al., where they studied the Betty Dodson method, which is using a Hitachi magic wand and targeted therapy, and 98% of participants had a orgasm, and these were all people who had been for an average of 12 years or prior. And so that is very strong evidence, and there were more papers to follow that kind of suggested the same thing. So no one's really surprised that vibrators are helping with function. But what is really interesting, and where urologists are more interested in kind of paying attention to this discussion, is the role of vibrators is an augmentation for treating stress urinary incontinence, which is common in people who have had children, like by vaginal birth, or is common in people who have had pelvic surgeries, like a prostatectomy for prostate cancer, or really any kind of surgery for their urinary tract, any kind of instrumentation in the pelvic floor that can, weaken that area. And so what we have found is that the use of this external, pressing of a vibrator from the outside promotes these involuntary pelvic floor contractions. And what that means is, I'm sure some of you have maybe heard of Kegels before. They're like this awful exercise that no one knows how to do, and that doctors are like, well, just look up your Kegel exercises and that'll make you stop peeing on yourself. And it's not just this magical cure. It requires a lot of participation, and it requires a lot of understanding of one's body and having this voluntary control of a muscle that most of us have never thought about in our entire lives, even though it is really the basement to the house of our entire abdomen, holding up all of our organs. It does a lot of work. And so what external vibration can do is it can promote these involuntary pelvic floor contractions and essentially be a fitness like augmentation to help you do those Kegel exercises and to promote pelvic floor tone. And this is really helpful for people who have low pelvic floor tone.